Upper endoscopy and colonoscopy can afford an evaluation of the duodenum and terminal ileum, respectively. However, reliance on these approaches alone can leave a large portion of the small bowel, and thus the vast bulk of the surface area of the GI tract, unexamined. When small bowel pathology is suspected, a variety of tests are available, each with their own advantages and limitations. Radiographic examinations, including fluoroscopic small bowel follow-through and enterography, are non-invasive, but provide an indirect cross-sectional examination. Push enteroscopy is limited to the evaluation of the proximal jejunum. Video capsule endoscopy can evaluate the entire small bowel, but only provides a passive evaluation without therapeutic capability. And the invasiveness of intraoperative enteroscopy limits its wider use. Balloon-assisted deep enteroscopy overcomes many of the limitations of other indirect, limited, passive, and risk-laden approaches to a small bowel examination. Balloon-assisted enteroscopy is performed with the use of a 200 centimeter length flexible enteroscope with an overtube affixed with an inflatable and deflatable balloon at the tip. In some instances, a second balloon at the end of the enteroscope also serves to anchor the device's position within the small bowel. The enteroscope tip can also be deflected at a sharp angle to facilitate this anchoring. The operator alternates between inflating and deflating, anchoring and releasing, while advancing the enteroscope and the overtube as the small bowel is pleated over the device like a curtain over a rod. This alternating advancing and pleating action gives balloon-assisted enteroscopy its alternative moniker, push-pull enteroscopy. There are numerous unique benefits to balloon-assisted deep enteroscopy. Enteroscopy is an outpatient procedure usually performed under deep sedation or anesthesia. It can be directed from an antegrade or retrograde approach in order to access any portion of the small bowel. In practice, complete enteroscopy is rarely indicated. In many cases, a non-invasive radiographic or capsule examination is first performed in order to properly select an appropriate patient and approach. While commonly performed for therapeutic purposes in the case of suspected small bowel bleeding, deep enteroscopy can also be considered part of the evaluation of inflammatory bowel disease, genetic polyposis syndromes, unexplained abdominal pain, or diarrhea. The diagnostic yield varies depending on indication and patient selection, but can approach 80%. Therapeutic interventions including hemostatic maneuvers, polypectomy, and stricture dilation, as well as mucosal biopsies or endoscopic marking with tattoo for surgical planning, can all be performed. In those patients with a history of gastric bypass, the balloon enteroscope allows for diagnostic and therapeutic maneuvers within the afferent limb or excluded portion of the stomach, and can be an option for the facilitation of altered anatomy, ERCP. The balloon enteroscope can also be used to complete an examination in those with a redundant or tortuous colon and history of failed colonoscopy. As part of our growth within digestive diseases at John Muir Health, we are excited to bring this novel technology to our patients as another option in the diagnosis and management of gastrointestinal diseases.